The study is Leadership 301 study. This study is looking at clinical research in interstitial cystitis and bladder pain syndrome. So, call may not know what interstitial cystitis bladder pain syndrome is. It's also known as ICBPS by many physicians. So ICBPS is a bladder disease with symptoms that include ongoing bladder pain that can often increase bladder filling, but may be relieved by bladder emptying. One of the main ways that it presents is having a pressure or discomfort in the bladder or pelvic area. Sometimes this discomfort is known as is manifested like in a burning sensation or a pain sensation. Oftentimes, there's the need to urinate frequently, or a very strong need to urinate, especially after you've used the bathroom and you feel like your bladder should be empty, feeling that urgency. So many of these symptoms might one believe that they have interstitial cystitis, or it might be that they already have a pain condition, and so it's difficult to differentiate between them. So that's one of the reasons that we wanted to come to this support group, was to share with you that many times people with chronic pain conditions like endometriosis often have other conditions too. We found that many people with IPS often have other conditions that include endometriosis, fibromyalgia, vulvodynia, and other chronic pain disorders or pelvic pain disorders. In fact, studies shown that about 50 to 65% of women with endometriosis also have ICBPS. Very high number. So that's why we wanted to present to this group. While it might have seemed like a logical fit at the beginning, hopefully with that statistic, you see that there are a lot of women that actually live with both conditions. So it's our hope today to be able to share with you more information about interstitial cystitis, as well as this particular study in case you are interested in helping move science forward through a research area, as well to empower you with information so that you can go onto the website for the study and learn more, or have conversations with your specialist, whether that's your gynecologist or your gynecologist, or anyone that you might go to for help with your condition. And this way you can be empowered to ask questions, to learn more about what's going on in clinical research, or to see if maybe this study would be right for you. People that aren't familiar with what clinical research is. Clinical research study is a closely supervised evaluation of an investigational drug. This drug is not yet available, but the study is looking to see how safe and effective it is in people. So any medication that you see that has been FDA approved, so it is on the market if your doctor prescribes it, it's gone through a rigorous many studies, to see if it is safe and effective condition. So the effectiveness. The goal of research is to add to existing knowledge about specific health issues. Yes, ICPS is one of those. And we'll see if there might be new ways to improve health. So even if you're part of a study and a patient does not actually fit and therefore is not able to be prescribed, there's still a lot of important lessons to be learned about medical research and about conditions, and this is learned through the study. Participate, and we know that it takes a lot of courage to participate in a study, because oftentimes you don't know, will it actually work? Will medication actually be available later on if it proves to be effective? But every person that's courageous enough to be part of clinical research actually helps to drive science forward, and it makes a real difference in the lives of others, even learning what's not working. That from personal experience being in clinical research, and when I say that, I mean I've actually been in a clinical study participant, so pain condition myself, and have gone through the process of going through clinical research, and I found that even though I'm not sure if the medication that I was on actually worked. I knew that the benefits were of driving science and learning more. So realize that it's a big request to go into clinical research as a participant, and we really appreciate that folks are willing to do that because they are helping. So if you see a study, you can go to clinicaltrials.gov, which is a government-approved website with FDA-approved studies to learn more. And you'll see on the screen here that this will actually provide more information about what clinical studies are. They're, again, highly regulated studies, ensuring that people are treated ethically and are getting the best care possible. So we do recommend that you use this website to learn more. So I want to share with you a study that focuses on ICBPS, a leadership study. And a study that's evaluating an investigational medication, not yet out in the public, study drug, to see if it's safe and effective for treating bladder pain and other symptoms associated with interstitial cystitis. So as about the pain, the urine frequency, the urgency, it's looking to see if it's safe and effective for treating all of those symptoms. Earlier clinical study in women with interstitial cystitis, and it showed the women that took the study drug daily for 6 weeks experienced bladder pain and improved symptoms compared to who took placebo. Placebo means an inactive study drug, so it means that there's actually no medication in the pill that one's taking. The researchers are able to see if the medication is working as compared to something that doesn't work at all because there's no medication in it. For this particular study, a person would need to participate in 13 to 14 visits throughout the duration of the study, and it lasts about 22 months. Is years. So that's a 12-week period, and this is a double-blind treatment period. So that means that 2 out of every 3 people that are in the study have a chance of receiving the study drug. That means the active medication. After that 12-week period, if you complete that, with a 52-week, so a full year extension study period, during all participants will receive active study drug. Now, that means that even the people that 12-week period who would then actually get the active study medication for that year extension. Follow-up of about 6 months after the last dose of the study drug so that everything is going right, that everything that they saw earlier is still working and just happening with the body afterward of the patients that are participating. Something that maybe sounds of interest to you, or you know someone who lives with interstitial cystitis, hear how you might qualify to participate. So we're speaking to all women tonight. A person would qualify if male or female and between ages of 18 and 80 years old, diagnosed with interstitial cystitis bladder pain syndrome for more than 3 months, but 20 years. Diagnosed 2 years or 10 years, you would definitely qualify. But you definitely need to have a diagnosis for more than 3 months. To talk with your specialist if you think that any of those symptoms kind of sound like things that you've experienced. Any diagnosis before coming into the study. To consistently have experienced bladder pain and that urinary urgency or frequency for 6 months. You need to be able to use the bathroom and go to the bathroom without assistance. So there are also things that might exclude someone from qualifying. So an active urinary tract infection, so a UTI, would disqualify you. If you have a history of chronic substance abuse or dependency, or abuse of opiates or other narcotics within the last 2 years. When we say that, we don't mean that you have been put on a medication that's opiate for pain reduction. The short-acting treatment, that's a long-acting treatment. This is where it's important to talk with your physician to see if you would qualify. So if this is something that is of interest to you, we can certainly send Megan information to then send to you, and you share that with your specialist and have a discussion. Take pain medication does not mean that you would be disqualified. Had a previous medical procedure that has significantly affected your bladder function, that may disqualify you. So again, very important to talk with your doctor about this. And if you're female and have had bladder tumors or uterine, cervical, vaginal, or urethral cancer, that's really important to know because it might actually disqualify you. And if prostate surgery or prostate cancer or are currently being treated for bacterial prostatitis, that would also disqualify you. So again, this is a study for both men and women. And we're speaking to women tonight. If chance you have a spouse or a friend or a family member who actually have interstitial cystitis, and we'd be able for you to share this information with him so that this is an option for him as well to consider. So yourself, why should I participate? Actually, a lot of very good reasons to participate. First, have access to doctors who are experts in interstitial cystitis and bladder pain syndrome. You'll learn what ICBPS is and how to manage your care, which can, as you live with a chronic condition, to learn more about how you can manage your care. Study drug and study-related care at no cost to you. So you have insurance to pay for anything. This will be provided free of cost. And we mentioned this earlier tonight, is that your participation will help advance medical understanding of ICBPS. And because this study may not actually turn out to have a drug that's you, or it may be that it comes to market as you'll need it. What you will, other women who also live with this condition and has lived with pain knows that it's a very isolating experience and it can be very difficult. But to know hope and that there's a possibility out there for finding a treatment, that offers a lot to people. And anything that we do for clinical research actually does help medical science, whether we move it forward by knowing what is good or we move it forward by knowing what doesn't work. But you can be part of so choose. So what you want to know in participating is that the study doctor will review all of the study materials, details, procedures, risks, and rights as a participant. When I started in my clinical trial, I was really nervous about that. But I have to say, doctors and their staff that do these research studies really make sure that you understand what's happening. And to ensure that happens, there is a form that that you have to sign. So you go through all of the details of the study, all of your rights. You ask as many questions as you want. Okay. That doctor is happy to answer those questions and walk you through everything to make sure you're okay. And that you understand what the study is about and what to you during the study. And once understood and feel comfortable, they'll sign a form just to make sure that you feel comfortable. Study, you'll be able to ask questions and will be given as much time as you need to decide if you want to participate. This also happens throughout the study. If you have questions, you should always feel comfortable asking those. And consent form, after all of those questions are answered at the very beginning, the study screening visit. Now, the study is completely voluntary. You can stop participation at any time. And I can personally attest that this is true. The study that I was in, I was almost at the very end of the study when I got a job offer in a different city. And I had to move, and so to leave the study. There were notifications, there were no consequences, no upset, no one had any concern whatsoever except for making sure that I understood that it was okay to leave at any time. And that's too. If visit, 11 visits, even 52 weeks of visits, if you needed to stop for whatever reason, you certainly may. It is completely up to you whether you participate. And no doing so. You can quit any time. That's your right. Again, there are fees and no loss of benefits that you have received, so you can leave at any time. Learning more, we would invite you to go to the Leadership 301 study website. There is additional information about the study. There for you to find your closest study center. You have that online, which is very easy to access website. You can also go to the clinicaltrials.gov website, the one earlier that had information about what clinical research is. You can write, and this specific study will be on that website. And the reason that it's on that website is because it's been FDA approved and evaluated. So that the government has evaluated this and it has met the standards necessary in order to practice research. If you are interested in learning more or questions that we're not addressing tonight, you can reach out to Megan, and Megan can either reach out to me and ask those questions, or I can provide her with a study brochure that you can then take to your physician. I'll provide it to you. Goes out, what I want to let you know is a little bit more about the study, and this is the company that is funding the study and Science Forward. The pharmaceutical company is Equinox Pharmaceuticals. It's based in Vancouver, Canada, and San Francisco. Clinical stage pharmaceutical company, about 50 employees. Now, in clinical stage, we mean that all of the medications that it's studying right now are study phase. None of them have gone to market yet. So you wouldn't see any commercials for them. You wouldn't be talking to your doctor about them yet in terms of something that's prescribed. This is research area. Doing a lot right now. It's discussing and developing specific medicines for inflammatory disease, and that's what IC is. It's an inflammatory disease and cancer. Studying a new possible treatment for IC, which for many people is a debilitating chronic inflammatory disease that affects millions worldwide. So please, if you do have IC or you think that you do, you are not alone. And so groups like these are definitely wonderful ways to be able to connect with people who can better understand your condition, can offer support may not be able to provide because they don't fully understand your condition. Please know that you're not alone, that there are millions out there that also have this condition. Many of them don't know it yet, and many of them do and are working with their physicians to better treat. And getting information about Leadership 301, about Equinox, and most importantly about what clinical research is and ICBPS, I'd like to say thank you so much for having me here this evening. And I'd like to take any questions that you might have. If there's an answer that I can't provide tonight, what I promise to you is I will take that information back to Equinox and make sure that we provide you with a scientifically accurate information so that you can make an educated decision about clinical research or about engaging your specialist in more about what interstitial cystitis is.
Great so much, Dev. So if you guys look in the right side of your screen on the bottom, there's a Q&A box, and you can go ahead and type some of those questions. We have some already, so we're going to jump right in. So is there a window in which I would need to sign up? When is this trial ending?
Great question. Thank you for asking it because you're right, I did not actually address that. Right now, we're currently in the process of enrolling, so you can sign up for any time. but it is expected, and this is all dependent on how many people enroll, but it's expected to end at this calendar year. Going to be future studies and studies on clinicaltrials.gov that you might be interested in learning more about. This study has finished, and you would participate in a study that's relevant to you.
Great. You also mentioned visits during the trial. Is there a geographical location that the women would need to be in?
An excellent question. And the answer is yes. So realize that interstitial cystitis is a very painful condition, and so it can hurt to sit or drive or actually just get out of bed sometimes. And so what we've tried to do is on the website that I've mentioned, provide to you a locator. So go onto the website, you can find a study that enter your information in, and the study site that's closest to you will contact you, let you know that it is in your vicinity. And try to find places that are about 50 miles, that's 50 miles from a person, so that while it's not next door, it's a reasonable amount of distance, so that hopefully it's manageable for someone to feel like they can participate. And then that site you or you call them, you can have a discussion about, is it close enough to me that I go there? And important to think about.
Thank you. Our question, our next person says, thank you for your helpful information. Could you go over what exactly IC/BPS is and how it correlates with endometriosis?
Absolutely. And in fact, if you don't mind, I know I'm going to scroll through these really quickly, but I'm just going to revisit a slide that I presented earlier that may not have been seen by everyone. So interstitial cystitis, pain syndrome, is actually do one more. Whoops. It is a bladder disease with symptoms that include ongoing bladder pain, that increases on bladder filling, and relieved on bladder emptying. So people that live with IC will describe the pain as either a very sharp pain or sensation, like almost like a match has been lit and stuck to their skin, like in the bladder. It's very painful for many people. And interstitial cystitis often has flare-ups. There are times where people will live with the chronic pain, and there will be never-ending pain for some people. For other people, they have these flare-ups where for a little while, things are fine. And because of stress or diet or other lifestyle things that cannot be controlled for, they'll experience the pain. And very, very hard for them. Into the pain, there's often a feeling of pressure or discomfort in the bladder or the pelvic area, and a feeling of urinary frequency. So that means the feeling to have to urinate often. So if you wake up a lot in the middle of the night because you go to the bathroom, that may be a sign you have IC. So talking to your doctor about urinary urgency. So if you have voided your bladder, if you've used the bathroom and you still feel like you need to go, or you've just got out of the bathroom and you have to run back in because you feel like you need to go, that is a sign of IC. In research, we found that up to 50 to 65% of women with endometriosis also have IC-BPS. People with chronic pain conditions often have multiple conditions. So people living with IC also have endometriosis, fibromyalgia, vulvodynia, many other conditions that can be painful. So this is where it would be really important or helpful to go to a specialist, whether it's your urogynecologist, your gynecologist, your urologist, or doctor, and just see could it be something that I have, and through it to make sure.
Great so much. Our next question is, can you give a summary of what is someone's legal rights in a clinical trial?
So, while I'll only touch on a couple, you'll get when you go to and through all of the procedures and what we'll have during the study. and on this participation slide, you'll be given your rights as a participant. And some of those rights include the right to ask questions, to disengage at any time. So again, this is completely voluntary, and if you choose to leave, you can. So ask as many questions as you need to feel comfortable. That is your right. It's also your right to have everything explained to you in a way that makes sense and that you understand. So those are some of many of your rights. And so when you participate, there's a participant bill of rights. You can go to the clinicaltrials.gov website to learn more about what rights are as a clinical trial participant. The site will also talk to you specifically about your rights through every single thing that will happen to make sure that not only do you understand, but that you're comfortable with it. And lastly, and this is for your protection, is that you will be asked to sign a consent form. Just acknowledge that you basically understand everything and that you're okay with it.
And if we end on that slide where you have the websites that people can go to, that would be great for everyone to just see down everything. And I want to thank Devra for joining us tonight and for giving us this information. And also, those of you who attended, thank you. And I also want to reiterate what she said about contacting me. My email is Megan, MEGAN, at rmccharity.org or .com, and you can contact me if you want more information. I can connect you with Devra or seek out that information for you guys. So once again, thank you to everyone. Thank you to Devra, and this presentation will be up on our Facebook and our website soon. So feel free to share with everyone and get the word out there about this. So thank you so much. And
again, yeah, before we go, just one other thing, and I'm so sorry I didn't mention this earlier, but things that we found out, and would love to extend this offer to the folks on the telephone, is that for many people, and I mentioned this earlier, their pain condition can oftentimes be very isolating. And even they may not qualify for this study, we would love to learn more about their personal experience. If anyone felt like they would like to share that with us, so that we understand if the limitations to the study that we're not aware of, or things about your condition that you don't know how to explain to your doctor or talk to them with, or frustrations that you've had as a patient, any of your lived experience with IC or with pain, we'd really like to learn from you. So if you feel comfortable sharing that information, you can get with Megan, and Megan can then share that with us, and we can blind that so that we don't know who you are. We know about your experience. Because even if you do not qualify for a study, every week we can learn about what it's like to live with IC, help science forward. Only if you're comfortable, but we would like to extend that invitation to you to be able to know that you can share that with us.
And I think it's so important for people to share their experiences and to educate one another. So I thank you and your organization for having that perspective on this. And I invite all of our people to take people up on offers like that. So again, thank you to everyone. And if you have anything else to add, Devra, if not, we'll go ahead and close it out.
Having us here this evening. I really appreciate being able to speak to everybody. And Megan, for all of your support.
Thank you. Well, good night, everyone, and keep an eye out for our next webinar, which will be taking place next month. So, yeah, thank you.
Thank you.